I mean, how do you guys have all had long careers, some private ambulance time, fire time. How do you guys overcome like some of that stuff that really burns a lot of us out?
So one thing that I've done is I don't live where I work. So I don't see my neighbors. I don't see people at the grocery store that I've ran on or potentially could run on. Where I live, I'm just John. So I've done that. I've also taken myself. I don't do stuff outside of work. I don't do work-related things outside of work. So I try not to talk about work. I try not to talk about or, do the shop talk when we get together. If we do, it's like 5-10 minutes, and then it's talking about golf, talking about kids, just truly separating myself, having two different people.
Yeah, that's good. That's actually a point I don't think I've ever heard on this podcast before, that kind of separating yourself from the job. I think that's good. Yeah, even living in the city where I ran so many calls is hard, because when you do go out places, you're like, I think I know that person, or especially the volume we see in the ER now, that becomes even more likely. You're like, I know I've seen that person this week.
You go to the park and you see, you're like, oh, this happened here. Or you run into that patient that they were in a compromised position and you don't want to make eye contact.
Yeah.
And they don't want to make eye contact.
Yeah.
They see you, you see them.
Yeah, or God forbid you run on someone that you knew before, which has happened to me as well, which that is very awkward and difficult. And that definitely contributes to burnout, because you're trying to toe that line of, dealing with someone taking care of someone is tough. I try to avoid it at all costs. Yeah. Just because it's it's now this personal weird space. They're in a compromised position, or they're having the worst day of their life, or whatever it is. They're not their normal selves. They're not wearing that mask that we all tend to put on, so it's a very difficult position to be in if they're now having to activate 911.
Or even, a level above that, having to take care of someone who was once responsible for your training. Whether or not they're in a position to recognize you.
Right.
Yeah.
A little pressure there, yeah.
Right? I would actually argue that it's worse if they are able to recognize you, because then they're at least, they're of the cognitive capacity of being able to evaluate what you're doing. And I think, at least for me personally, it put me in a very hesitant state of, what I hope I'm doing the right stuff, and let me double check this, that, and the other thing. And, I want to make sure that they know that they trained me well and that sort of stuff. But yeah, that one will definitely throw you for a loop if you've never experienced it.
Well, it compromises your ability to be objective and see them as a patient.
It does.
Which we're all trying to do. Like, yeah, we understand their humanity, but sometimes when we're at work, we need to see them as a patient so that we're not taking everything home with us anyway. So you need to see them as a patient, but if you know them or, in some other capacity, that kind of ruins your objectivity a little bit, I think. So you tend to do more rather than less to compensate for that, I think.
Absolutely.
What else you guys got for as far as kind of avoiding burnout and having a successful long career?
Retire.
Get out young.
I think a lot of it is awareness, and sometimes it's even hard to recognize that in and of ourselves, but a lot of times a loved one knows. Like, man, you seem like you've been off lately or whatever. So having that at least awareness to realize, like, maybe I need a little bit of help here. And I'm a huge proponent for therapy. I think therapy is awesome. I think everybody should experience therapy. I don't think it has the negative connotations that it once did. But who wouldn't want a life coach?
Yeah.
Who wouldn't want somebody to kind of help you work through these things? And I think we're especially privy to seeing a lot of negative coping mechanisms, right? We see it every day at work as we run on people. And so we realize, like, I don't want to go down that path. Let me try to find a healthier way. So getting out, we live in a beautiful state. It's nice to get out, do other things. Kind of get away from the job. But burnout it's a big deal, especially over time, shift work, working a lot of hours. Sometimes it feels like you can't get away from it.
Do you guys have as many harbacks as you used to?
No.
Well, everybody's going to experience burnout. I mean, well, it's gotten better, but burnout and PTSD, I think that's overused a lot as PTSD, But
it
there's
is
something there. I don't know if want to call it PTSD or whatever, but there's something there, and it happened to me too. I mean, I was sitting in a motor vehicle department in Fort Collins with my wife, and I just started crying. Didn't know what. She goes, "What's the matter?" I said, "I don't know. And I went and got help.
And that's, PTSD gets kind of a bad rap as a diagnosis because, similar to burnout, which I'll get to in a second, is historically been a term applied to people to suggest a lack of coping. And it's not necessarily a lack of it's not a lack of desire to cope, right? That's the big thing, is a lot of these people want to cope. They want to feel better. They don't want to feel those invasive thoughts and crying for no reason and all of a sudden having a panic attack. But for whatever reason, at least historically, again, going back to the weakness mentality, it was seen as a mark of weakness to have that diagnosis. And so people didn't want to go to see a therapist to potentially get that diagnosis. And it is a diagnosis, right? It's a pathology that, just like anything, has treatments available, right? People don't want belly pain, so they call EMS to go to the hospital to get sorted out and discover, oh wait, I've got appendicitis, or oh, I just have gas. Right? Those are the two ends of the spectrum kind of on that, but the point remains. And I would argue that burnout, the term burnout, is similar because it places the responsibility on the individual rather than the system. We're not burning out because we're not resilient. We're not burning out because we can't cope. We are becoming morally injured because of the demands placed on us by the system that we work in, by the fact that our agencies are understaffed, that obviously for private ambulance it's a little more pervasive, but that the pay isn't what it should be, that we don't have XYZ piece of equipment we've been asking for however long to actually do the job that we need to do, and subsequently getting yelled at for not doing said job that we've been asking for said piece of equipment for, right? It's not any fault of anyone's if they experience that moral injury. It's what we do with that is the most important thing. How we respond to it, how we cope, and the tools that we employ, whether it's therapy, whether it's golf, whether, whatever, to facilitate moving through that. Not moving past, because I don't think we ever truly get past it, but moving through it.
Yeah, and I always push back on you on this point a little bit because I still use the word burnout because I feel like we only have control over ourselves and we can't control the systems we work in. I don't disagree with you. Like, part of the reason that there is so much burnout is because of the pressures of the systems we work in, the lack of, right resources, having to work too much, not getting paid enough, whatever it might be.
You got to get these people through.
We have no control over any of those things. And so that's why I still use the word burnout, is because I feel like it does put the responsibility on you as the individual to fix that, because nobody's coming to save you, and with the department you work for, the private ambulance you work for, they're getting better, and I think they're getting resources in place slowly, and we certainly need to be pushing for that. But at the end of the day, it's still your responsibility to go see a therapist or come up with a hobby that brings you life after a hard shift, and it's on you to not pick up a bunch of alcohol after your shift to cope, and to, do something else to unwind. That's my only pushback on that, is I like the word burnout because it does put the responsibility on the individual, which is not solely to blame, but they're the only ones that can do anything about it too.
I would also add, picking up those extra shifts, time and a half is great, but you don't have to do it. Mandatories aside, because we've been in those states of where we're told you don't get to go home. But we choose to pick up those extra shifts, and we could say no.
Mm-hmm.
And I guess I will amend my statement based on one thing that you said. Yes, it's the responsibility of the individual to figure out ways to mitigate those feelings. But again, exactly as you said, it's not the blame. I think that's the most important piece. I think burnout also, primarily burnout artificially assigns blame to the individual,
right,
as opposed to blame to the system. So that's the main qualification that I will change. Thank you for that.
Well, and it's a gradual onset, I think, because when you get into it, you're just all, I'm going to go save lives, I'm going to do this, and you're rah-rah, gung-ho, and then call after call after call after call after, after a while, it just, and you don't even realize it. You realize there's, like I said, something's wrong with me, or my wife said something's wrong with me. And you don't even know it. And then you go get help, and then they bring that stuff out, and they kind of help you get through it.
Mm-hmm.
I think there's also resistance to getting help because we're the people that go help, right?
Right.
We're not the ones that need
Well, it's
help.
another stigmatism, like we talked about that earlier. That's something that's like, oh, you ain't got help? Not me. I'm Joe Tough Guy. I guarantee you, there's not a guy on the job that hasn't suffered from some sort of burnout or PTSD. Male, female, doesn't
Certainly
matter.
get
Someone
jaded,
has, and they deny it all they want, but they've been injured mentally. Someone's injured.
Absolutely.
Would you say that burnout is inevitable? So if you're in this field for so long, you are going to get burned out.
That's a good question.
And then how do you recover from that?
I would say, and again, I'm not going to use the term burnout. I would say that moral injury is inevitable. Something is going to happen, whether it's a particular case, whether it's a policy that's implemented, whether it's a period of time where staffing is particularly short. Something is going to happen that to each of us, if it hasn't already, and likely will happen again. To anyone listening as well, where there will be some form of moral injury. The important thing is recognizing that it has happened, and rather than just allowing it to be, having that conscious mindset of if and more likely when this happens, what am I going to do about it? That piece, I think, is protective. Having that mindset of, I know this is going to happen to me, but I'm going to find a way to take action against it. Whatever it is, I'm going to fight it. I'm going to go to the administration or, take things up the chain of command or whatever and explain, look, this is what we need. This is what should be happening. The evidence says X, something to facilitate that change, to prevent it from happening to anyone else. Or if it's something that there is literally no control over, such as a bad call, for example, having those mechanisms in place to get out on the golf course, to go build something if that's your passion, to having those other aspects of life as outlets.
I think the solution changes too, because there's acute and chronic issues, right? I mean, you have the slow fade of years and decades of running these bad calls. Maybe one particular shift wasn't bad, but it's that chronic, slow fade of brutal call after call after call versus, maybe one shift burns you out because that one shift is really difficult, and I think the solutions kind of vary to both. I think the acute phase, it's like, well, if you have a day off and you go golfing or do something you enjoy, maybe it's fixed in a day, but that kind of chronic issue, I think, takes more therapy and more invasive things to actually correct.
And let's not forget the fact that we just went through a worldwide pandemic, which had significant impacts on the mental health of not only the general population, sure, but responders as well, because we were forced into some very, very difficult conditions to operate in. Having to, don all the gear and sweat underneath it and not be able to feel like you're getting fresh air and, taking however long to decon the ambulance after every single call. And also, guess what? You're getting to work another 12 hours because there's no one here there's no one coming to replace you because they got sick with whatever. Like, this is not an isolated thing. There will be another pandemic, whether it's because of an infectious organism or it's something that we attribute to, we draw the analogy of a pandemic, right? But there's going to be something else that taxes the system, taxes the resources, taxes us as members of the response community. And understanding those things, like now, like you said, with the label of PTSD, of having things be more recognized. And as Jason, you said, the understanding that therapy is okay. I think we are finally reaching a place of acknowledging that self-care, self-mental health help, and developing those protective factors is appropriate.
And I think you got to get to the point where you acknowledge that something's wrong. You have to acknowledge it, but then you have to go on living. And what there was a show out. It was with Russell Crowe, and I've told other people this. The Beautiful Mind.
Mm-hmm.
And what a great show that was. And at the end, when he looks over and he sees that guy, he
Spoiler
acknowledges
alert.
him. Yeah, it's an old show.
Yes.
He acknowledges him, but he chooses to go on living his life. And that's where you have to be when you've suffered some of the things you've seen. You drive to the intersection where there's you acknowledge it and then you go on.
Mm-hmm.
You got to get to that point.
Mm-hmm.
Yeah, instead of allowing that to like get stuck in your brain and start thinking about it over and over again.
Right. Especially if you made a mistake, you did something wrong. It's like, no, okay, I've seen that. No, let's
Yeah.
go on.
And learning from it. That's the big thing is, okay, I made this mistake. This is what I took away from it so that I make sure that it doesn't happen again.
Mm-hmm.
What made you stay a career paramedic as opposed to kind of going up the chain in the fire department? Was there anything specific, or was that an intentional decision?
That's an interesting question. So in our system, when you promote, you're typically kind of put back into the thrush, right? It's all the stuff, staying up all night and all that stuff. I've gotten to a point in my career where I'm at a house that I really like. I'm with a crew I really like. I'm comfortable where I am. I've certainly made kind of gone back and forth on that. And then the other part of that I'm still wrestling with is I don't want to just do it for the money, right?
Mm-hmm.
I want to be passionate about this move if I'm going to make that move,
Mm-hmm.
and not, in retirement, I'll be like, I should have done it for the money, right?
Right.
But now I'm just like, I would rather do something because I really like it. I really am interested in it. And I'm still interested in the medicine. I'm still really interested in being in that position, running those calls. I love it. So in a lot of ways, it's like, why would I want to stop being happy, right?
Yeah,
I would keep doing what I'm doing. But it's not for everybody, right?
Mm-hmm.
I have to really watch that burnout. There's that, jaded piece that we all get, recognizing that and going, okay, well, I do have options. There are resources out there, that sort of thing.
Well, it sounds like you're in kind of a position where you can avoid burnout more if you're able to sleep more at night and you're getting to do what you love. So, I mean, that's good.
Yeah, and we all want our health at the end, right?
Mm-hmm.
We want to enjoy the ride as we go, but we also have to think long term and go, okay, what's retirement going to look like? Well, it's not going to be as good if I'm not as healthy and
Work to live, not living to work.
Yep.
right.
Yep.
That bigger picture stuff.
Yeah.
Get more money out of retirement than you put into it.
Mm-hmm.
So live longer than you worked.
Exactly.
Or retire longer than you worked.
Just don't retire in this last week.
Oh,
No.
yeah.
Wait a little
Oh,
longer.
yeah.
Potential
Well, just
earnings.
don't draw on your 457.
Yeah,
Just leave it alone.
let it sit for a little bit. Don't freak out.
One of the last topics I want to kind of talk about is interactions with fire versus private ambulance on scene. And unfortunately, we don't have any specific private ambulance folks other than myself here. But we do have people that have worked private ambulance, and I'm going to probably have some of them on this next week. So I'll get their perspective as well. But what are kind of the keys to having a harmonious scene with the private ambulance crews?
I think egos are huge in our field. Kind of having that perspective of like, this is maybe somebody from a different agency, but truly this is a coworker. And it's not just this scene, but it's the 100 other scenes that we're going to run after this. And I would rather have that good working environment than to have hostility at every turn, right? And so I think it's that mutual respect that comes and says, hey, I may or may not be working with this person more, but I would really like some help when the time comes, you know? And then being on both sides, I think is huge, because you see both sides of that coin and you realize like, oh yeah, this is what it was like when I worked on the ambulance. This is what it's like when I work on the fire department. So I think that helps too, because you can be a little bit more maybe compassionate towards what the ambulance side is going through, knowing like, man, they probably didn't even have a chance to eat today. They've been so busy. And so kind of treating that mutual respect, I think, helps a lot. A lot of it is attitude on scene, right? Approaching that scene with like, hey, how can we help? You were here first. How can we help? You know, I think that goes a long way. And then getting along with people, playing well with others as best you can, which isn't always easy to do.
Right.
And in my experience, you know, there's always personality conflicts and so forth, right? And there's been people that I thought, I will never get along with this person. Like, it's just not going to happen. I've given up. But then at some point in time, I realized, like, why don't I just have the conversation? Or they'll ask me directly, like, I know you don't like me and I want to know why. And I'm like, oh, you really want to know? You asked, so here we go. And I've had this conversation with some people that I thought, I don't know that I'll ever get along with this person. We just have too many differences or whatever that is. And then we have the conversation. You know, maybe I bring that olive branch forward. I had a ambulance crew that it seemed like we were always butting heads, and I could never put my thumb on what that was. And I just finally said, hey, you guys want to come over to the station? We got some extra pies. You want to come have some pie? And just the act of them having that in a non-emergency situation, you know, this olive branch that I extended, from then on, we worked really well. It's not like we worked out all our problems. I think we just had more of a push, pull, give and take kind of thing. It was just like, hey, we had pie with these guys.
Right.
Maybe we should all get along, right?
Yeah.
And so it's something I had to like learn the hard way, though.
Yeah.
Kind of feel my way through.
I think part of it's when you don't work with someone on a daily basis, or you don't know them in a social setting, or, you know, you're meeting them for the first time on an emergency scene every single time. Like, it's easy to assign like ill intent when they don't necessarily mean any, like, you know, a harsh word, or, you know, the way they phrase something, you tend to assume they mean it in the worst possible light, when maybe that's not the case. Versus the crew that you live with and work with every single day, you know that if somebody says something a little bit weird on scene, you're like, oh, okay, I know this guy. Like, I know he didn't mean anything by that. And you assume better intent on their part. And I think that's where some of the strife at least comes from, is just not knowing each other that well all the time.
Right, for sure.
But
Well, another thing is not knowing the hierarchy of how things work. Coming from the ambulance side and going to the fire side, you know, I didn't know, you know, you got the officer, well, there's a lieutenant there, but you didn't understand his role. You didn't understand the role of the driver. You kind of understood the role of paramedic and EMT, but you didn't understand the role when it came to a fire or traffic accident, what their roles were. On the ambulance side, you just show up and go, what are they doing this, you know, or what are they doing that? You just don't know. Vice versa, the fire doesn't understand the ambulance side. You know, they're not riding to the hospital. They're not having to take this patient into the doctor, that you got them on a spine board because their knee hurts.
Right.
You know, and you got to, you got to explain that. So if you were, you know, taking the patient in and giving those reports too, you'd see how that hospital side works and what they're going through, and get to know the doctors better.
yeah.
So there's a little bit of that. But another thing that works really well to get along, and this is from an old paramedic guys talking about, I'll say his first name is Eric, and everybody knows what I'm talking about. But he said bonding call. And that works so well, when a bonding call, when you go on a call that's really bad call, and you all jump in there and work together. I had a crike one time with a guy, and if he listens, he'll know exactly what I'm talking about. Where we criked, and we got along before, but I don't see this guy. I can go years and not see this guy, and the first thing we do, he'll go like this, you know. We had that bonding call in the
It's
back
like trauma
of the
bonding.
ambulance.
Trauma bonding. Yep.
Yeah, trauma bonding, and it brings you in. So now you're friends. You hated each other the day before. Now you're buddies for the rest of your life.
Yeah.
You know? I don't understand it, but
Right.
it works.
To me,
So-
disagreements are going to happen. So I think it's better to get together as soon as possible. So if that's riding into the hospital, having a discussion in the ambulance bay, inviting them over to the station, and having that discussion just so that next call, it's a fresh slate. Because I think 9 times out of 10, crews don't talk, and they let that small problem that could have been solved very, very easily right after the call, they let it fester and fester and fester, and then it spreads to other people. So I think handling those disagreements early on.
Yeah.
So John, how do you go about, as the officer, how do you go about establishing, for instance, if there's a disagreement about how to proceed on scene between 2 paramedics, what's your process like establishing who gets the quote-unquote final say?
So as a medic also, what I'll do is I'll bring both medics from the fire side and the private ambulance side, take them either outside into the hallway, into another room where we can have an open and honest discussion, and let the 2 hash it out. Just the way that the city charter is written, and if I'm going to back, unless it's something that's egregiously going to hurt the patient, I'm going to back my fire medic. And so I'll let them discuss it. And usually I've never had an experience to where they weren't able to come to a consensus. And then we go back in and we work as one cohesive unit is what I do.
And I think like our field just attracts so many egos and just big personalities too, that makes conflict just much more likely, because there's really not a lot of timid people in our field anyway, just by nature of the job. And I see a lot of crews, bring in patients, and if they're disgruntled at the fire department, it's usually over something that's totally inconsequential to the patient, but they've made it so huge in their mind, and they're so mad. They're like, I can't believe the fire department gave aspirin to this chest pain patient. I think maybe they have a thoracic dissection. I'm like, it's probably not going to make or break, anything in this patient's outcome. And, statistically, they're probably more likely to be having an MI than a thoracic dissection. So aspirin's probably the better choice. But they've made this like one issue like such a huge sticking point, and they're so mad about it. I'm like, guys, it's really not consequential at all. Like, giving aspirin or not on this call is not worth, being super pissed off for the next 3 hours about, and being pissed off the next time you run a call with them. Like, so I feel like a lot of times it's just small issues that are really non-consequential for the patient, because it's usually not an egregious thing. It's not like the 2 options being debated are completely that far off. It's really just small things.
A lot of times communication, and I tell people, it's like we want to vent and all that. That's all normal. That's all healthy. However, when it gets to the point where it's just like they're just mad, it's like, okay, what's the most productive thing you could do now?
Right.
Probably have a discussion.
Right.
Kind of hash this out, figure it out, however that looks. But at least make the attempt to.
Yeah.
Otherwise, you're just like, I'm going to have a bad day every time I see that person.
Yeah. And on the ambulance, I think it's easier to stuff it down and be mad, because you guys work with at least 4 people usually. And so I think you're probably used to some interpersonal conflict and having to figure this out. Versus on the ambulance, you're like, I probably won't even see them the rest of the day, or it's just you and your partner against the world, and you're going to be everybody that you have a conflict with, you're not really going to try to resolve it. Whether it's the ER doctor pissed you off because they didn't listen to your report, or they didn't like, the differentials that you thought were going on or something, or didn't like the medicine you gave the patient. You can, instead of asking them why, like what could I have done better, they just get mad about it the rest of the day and be like, I can't believe that, they didn't think I should have given this medication or whatever it is. I think that's easier to do on the ambulance side, when it's often seen as, the 2 cowboys and it's them against the world, versus having this culture of trying to solve interpersonal conflict more often. But
and definitely we're all on the same team. Like, we all want the same outcome.
We're on team patient.
Yeah.
But and to your point, if there is that disagreement, one of the worst possible things that you could do, aside from having a physical altercation over it, is to document that disagreement as accusatory, right? So in the medical legal world, that's called jousting. And for anyone listening, of course, that is probably one of the most problematic things that you can do in that type of situation, of saying, so-and-so gave this medication despite the fact that I said don't do it, or that I believe that this was the better course of action. That can generate a lot of downstream consequences that are potentially unforeseen. And if that particular chart goes to a legal review for some reason, lawyers will eat that up.
Why is it that they eat that up? Like,
it's for a couple of reasons. Reason number one is it shows a non-cohesive team that is providing care to the patient, and that disagreement may have resulted in altered, I don't want to say altered judgment, but compromised judgment when it comes to what care to provide to the patient. It could potentially identify one individual as as providing care in an inappropriate, negligent, biased, whatever type of way. Whether or not that's actually in the chart, it can be used to paint that picture, because that's what these lawyers are good at, is painting a picture to achieve the outcome. What's the outcome? A win for their client. Mm-hmm. But the other thing it does is, if it exposes discrepancies, and I'll speak to specifically in our system, because we have two separate charts that are created. One of the things that those discrepancies can do is allow a legal team to say, well, it's documented that way in this chart, but it's documented this way in this chart. So which is the real way that it happened? How can I be sure that any of these are correct? And it allows them to paint the picture they want, because they have been able to cast doubt on the entire call.
Yeah, so the credibility of the whole team is now in question, rather than it being protective against you saying, well, I disagreed with this and they did it anyway. Instead of that protecting you, it kind of throws everyone's credibility and puts everyone on the hook maybe more.
Exactly.
And we have the opportunity to do this in the ER and our charts too. Every time we talk with a specialist and we disagree with what they want to do or not do for a patient, it'd be easy to say, well, I asked them because I thought this needed to happen and they disagreed, here's their name and blah, blah, blah. It's easy to do that on our side too. And we have to protect against that verbiage, in our charts as well.
And sometimes it's a cultural thing, right? Where we take this group of people and we're like, oh, they're one of those. I always tell new people, have an open mind, right? We've all probably experienced this where someone's like, oh, so-and-so is terrible. You've never met them, but everyone's just talking about them. And then when you do finally meet them, you're like, I don't know why everybody's complaining. Right? It seems like a decent person, right? And the same thing happens, I think, in our industry or our field, where you're like, just because they're a firefighter doesn't mean they're going to be horrible to work with.
Right.
Just because they work on the ambulance doesn't mean that they're going to be a huge ego and have all these issues all the time. Right. Why don't we try to breach that and break that?